All right. Good afternoon, everyone, and thank you for joining us today for the Agricultural Health and Safety Network's 2021 Annual General Meeting. My name is Adam Brome, and I'm an Administrative Coordinator with SARM. We're going to start off today's meeting with a brief intro to the Adobe Connect platform. We will then transition into the main presentations, followed by a Q&A session. Please note that today's meeting will be recorded, and a copy of that recording will be available on our website under the webinars page following today's session. If you're ever experiencing any issues with your audio, first make sure that your speaker icon on the top left on the left side of the top toolbar is green. This means your audio is enabled. If you're still having issues, please refer to the drop-down menus located on the top toolbar for additional assistance. Sometimes closing your window completely and rejoining the session helps as well. Please also note that if you're joining us through your internet browser, Google Chrome tends to work best with the Adobe Connect platform. We recommend downloading the Adobe Connect desktop app if you are experiencing any issues with your audio or video, as it tends to offer a better experience. There is a chat box located on the right side of your webinar window that can be seen by all webinar participants. You can use this to engage with other attendees, bring any technical difficulties to the speaker's attention for troubleshooting, or to provide any comments and feedback. If you would like to be a mover or seconder to any decision items during today's meeting, simply type the word mover or seconder into the chat box to identify yourself as such. Please note that there is a dedicated question and answer box labeled Submit Questions Here, which is located right underneath the chat box in the bottom corner of your screen. This is where you will submit any questions that you may have regarding the meeting subject matter. Please keep all questions you wish to be answered by the presenters to the Q&A box only and not the chat box, to ensure that they will not be missed. The Q&A box will be open throughout the duration of today's event. There will also be a copy of today's presentation available for download during the Q&A portion of the session next to the chat box. Please let me know in the chat if you're unable to download the file, and I will email it to you directly. If you're experiencing any technical issues during today's event, please notify us in the chat box and we will do our best to troubleshoot. I will now hand it over to our meeting chair, Mark Hughes, who is the Reeve of the arm of Miry Creek, number 229, and the Division 3 representative on the Agricultural Health and Safety Network Steering Committee. Take it away, Mark.
Thank you, Adam. I'd like to welcome them all to the Agriculture Health and Safety Network Annual General Meeting. Couple notes right off the bat. We'd like, and I'll reiterate what Adam said, if you're up to moving a motion or seconding it, please type it into the box and your RM, and so we know who you are. The next thing is, I hope you're all doing well. We're going to jump right into the meeting, so I'd like to call it to order. If you would please review and acceptance of the agenda, take a minute to take a look over it. We will be trying to get through the agenda fairly quickly so we don't hold too many people up today. Once you've looked over it, can I get someone to please move the agenda? And someone to second it, please. Sandra moved it. Can I get a seconder, please? Thank you, Alicia Blake. I hope I got that correct. Okay, the minutes, review of the minutes from the 2020 AGM in Regina have been distributed. Hope you've had a few minutes to go over them. Is there any questions or concerned about the minutes for the 2020 AGM? Questions or comments? If not, we'll be moving right along with this as well. If you've had a chance to read over them, could I please get a mover and a seconder, please? Thank you, Sandra. Could I get a seconder on that, please? Thank you, Sonia. Now we're going to move on to greetings from Dr. Niels Koehncke. Sorry, I'm going to pronounce it wrong. With Koehncke, with Canadian Centre for Health and Safety in Agriculture. Welcome, Niels, Dr. Niels.
Thanks, Mark. And thanks everyone for joining. Welcome to our virtual AGM this year. And thank you for signing up and coming. We usually obviously present during the SARM convention, but a lot of things are different this year. Thanks again to SARM for hosting us on this platform. And so what I'd like to do is we'll start our presentation. I'll go through a quick introduction from the center, turn it over to Kendra for further review of the activities and updates, and then we'll go through financials and some awards presentations, including the scholarship. So it's a slightly different order from the sequence, the way it was presented in the agenda, but the same content. All right, and this is just a cover of our annual report for this year, Partnering for Success, and I think it's something we've been able to continue this year, and you should, if not already, be receiving a copy of that shortly. I think we'll also make sure to post it online. So greetings from CCHSA. Again, thanks, Mark. I'm Niels Koehncke. I'm director of the Canadian Centre for Health and Safety in Agriculture and one of the faculty co-leads for the network. And I'm a physician by training. Occupational medicine is my area, and I involved in occupational health and safety from the medical side, both in agriculture, of course, through the center, but also in other industries. Our physical home, as I'm sure many of you are aware, is on the university campus in the Health Sciences building. We are over here on the first floor of the Health Sciences building, which faces College Avenue. It's incredibly quiet in there for the last 12 months, of course, because most things on campus are still shut down. I'm there today just for a better internet connection, but things are much different than they have been. But this is our physical location, and when things open up again, we're always happy to show people around and tour them through our labs and our facilities. The network has been around almost as long as the center has, and our mission is to improve the health and safety on the farm through education, service, and evaluation research. And the ultimate goal of that, of course, is to reduce injury and illness in agriculture and in rural Saskatchewan through a variety of means. And our membership right now has dropped a little bit from last year for a few reasons, but we're at 206 RMs. And that's our famous map there that changes every now and then. The governance, just as a reminder for our network, is through a steering committee and also with participation from the Ministry of Agriculture ex officio. And that person is Angela Hall. And thanks again, Angela, for continuing to serve in that role. And thanks to all our steering committee members who are listed there and who've served on the committee in the past. Ken, of course, in Division 1. We have a few gaps that'll need to be filled after this year. but Mark in Division 3, and Miry Creek, Brenda Zemlick, Division 4, Walter, Division 5, Bonnie Mills Migley in Division 6. So our activities and our plans and our goals are really set in conversation and partnership with the steering committee, and we're really grateful for their willingness to serve. And a thank you to a couple of steering committee members for their dedication to the Ag Health and Safety Network, and their membership their terms are ending, and that's Bonnie and Ken, who we've just highlighted. But thank you for your dedication, Bonnie and Ken. I hope you're present. I'm getting used to this platform, but I can't see the whole list. Thanks for your involvement and your dedication to supporting what the network's about and supporting health and safety in Saskatchewan farm families. And there's a picture of the plaques that you will be receiving, which unfortunately we can't hand to you in person. What I'd like to do now is the next few slides go through the activities and the work that the network's been up to. So I'm going to turn that over to Kendra and then come back a little bit later. So thanks, Kendra.
Good afternoon, everyone. Can you hear me okay? I hope so. For those of you that don't know me, I'm Kendra Ulmer. I've been with the network now for about 16 years, and I always enjoy SARM convention time, our opportunity for our network AGM. The last time we had our AGM, we were in Regina in person, and let's just say a lot of things have changed since then. I'm trying to kind of look through the participants list to see if I recognize some of the names. I always enjoy the SARM opportunity, being able to connect with a lot of the administrators and counselors and just share with them what's happening in the network. And I sure missed that. I know at our trade show booth, we I guess it was the 10th, 11th of March last year. We put a little bottle of Isogel beside our pens to put in the names for our draw, just trying to be extra cautious of things. Little did we know what the year ahead would bring. So since that time, I haven't been able to represent the network in person. We've been working from home and still trying to deliver occupational health and safety resources and information in the best way that we can, virtually and in print copy. But our in-person interactions have been on hold since March of 2020. So I'm going to go through our regular activities of the network and just comment briefly on the activities, and then I'll go a little bit more in detail of some of the partnerships and programs that we've delivered this year and some of our plans moving forward. So our network activities usually consist of a spring and fall newsletter that goes out to our membership. Our membership's about 25,000 farm families actively right now. And in one of those packages is usually our theme package, our newsletter, our theme package, and that focuses on a variety of topics throughout the years. And last year was our electrical safety. Another component of our program is our clinics, our one-to-one clinics in the rural communities, and that has been on hold. Our extensive health and safety library, both print and online. We usually do a series of webinars, workshops in the communities, and visibility at conventions, meetings, and any place where farmers are, we try to get there. And also our online presence with Facebook and Twitter. I would like to acknowledge a little bit of staff changes and welcome Brooke Thompson. She'll be able to join us here today. She's joined with KT support for our Agrivita program. And Tess Kelly, which many of you may remember her from last year's meeting, has moved to Kamloops in November. And other career opportunities, but we're very fortunate that she does remain with us at 0.25 remotely for KT assistance. So that's been one of the things about working remotely, is sometimes like just emails and everything. She's so good with contributing with the network's KT in that reduced capacity. So those are just a little bit of changes, and as the year progresses and resources available, we're looking to increase our capacity with our KT staff. So our funding and partners, just wondering if the slide, oh, there we go. It's fancy. It just goes one bullet at a time. Our core funding remains at $100,000 from the Ministry of Agriculture, and that's for this upcoming year. And we have a grant committed for a respiratory resource of about $10,000, and also receive funding from our CAP proposal to deliver the mental health and agriculture webinars and resources, and I'll speak more to that later. And that's in conjunction with a partnership we have with Bridges Health and Do More Ag, and that's for the value of $25,000. Both the CASA and CAP granting opportunities will be taking calls for this upcoming year, and we're hoping to apply and be successful for a little bit more additional funds for both of those calls. Also within our funding is an ongoing 4-year agreement with Agrivita Canada in relation to KT products related to the Agrisafe research projects. And it's a range depending on what we're able to spend on that, 40,000 to 60,000 per year, that can be directed towards the network and KT activities related to these projects with national distribution. And Brooke will talk a little bit more about that later. Also, the center and the network will be taking more leadership role on the ROPS program underneath this initiative moving forward next year. So this slide, thank you, Sueli, one of our communications staff, for putting this together for me. I just wanted to kind of do a visual to show the network in the center and show kind of us as the hub, and a lot of the partnerships that have just been instrumental in helping the network in the past years and this year and moving forward. And I'll speak to a lot of these partnerships, but that being SAS Power, Bridges Health, Do More Ag, SARM, even this platform. This is completely new, and really thankful that we're able to offer AGM through the web platform of SARM. Our students and research, the Ministry of Agriculture, it's our core funding, but we expanded this year to have a lot more involvement with the regional offices. The Agriculture Health and Safety Alliance, an international program, collaborating with them, and then CASA, and I'll speak to those in a little bit more detail here shortly. And this, I guess, a few other ones that I'm not going to go into detail with, but just very pleased and proud. I guess it's the Saskatchewan way, and the network does that also in terms of we're stronger together and collaborating our resources to try to get great messages of health and safety out to our membership. And we do that in collaboration with all these partners. So one partnership that I just wanted to touch on with the Ag Health and Safety Alliance. So this is the program in which we deliver health and safety information at the college level. That was being on hold, but it's being adapted virtual delivery in some places in Canada and in the US, and looking at in the fall whether that be a hybrid version of in-person or virtual, or if we can be in the classroom. So we've continued communication, getting the steps in line to get into the University of Saskatchewan in the fall, but also the last few months collaborating on a new respiratory health resource. So we received funding from CASA to help with this, and this new updated resource will definitely address concerns with COVID-19 and respirator selection and various respiratory health and safety issues that will be in this comprehensive new resource. And this resource will be used nationally within the Gear Up for Ag program the next few years. So we're really pleased that that will be one of the outputs. And then most importantly, it will be, not most importantly, but most excitedly about, in my perspective, is this comprehensive resource will be able to be distributed to all of our membership later this spring, and then used in our respiratory health clinics and other outreach initiatives in the future. Our mental health and agriculture webinars. I'd just like to thank the RMs for your promotion efforts in these webinars. I know Shelley made a lot of calls to the RM offices just to let you know a little bit about this happening, and you helped us promote this. This program, Walking the Talk Mental Health and Agriculture workshops, is actually part of a bigger project that we receive CAP funding for. That's that $25,000 that I discussed earlier. And it has many components to this project, but one being the in-person workshops that were planned to be delivered in each of the 6 regions of our province, very similar to how we distributed and worked at the community level for our Sleepless in Saskatchewan workshops. However, with our restrictions, we couldn't proceed with that delivery method. So we just went to webinars for right now, and we extended some of the project, and we're looking at different options with when restrictions are lifted, and also some supporting resources. And this is all looking at fostering mental health resiliency for farmers. The network understands that farmers are facing tremendous pressures, and now in 2020 and 21, it's more essential than ever that we provide resources and support and awareness in this area. It's important that we increase knowledge and awareness about mental health in agriculture. Walking the Talk Mental Health and Agriculture webinars are presented by the Do More Ag Foundation. I would like to thank the Ministry of Agriculture and regional offices for helping to promote these webinars. We've done radio ads, newspaper articles, and they help facilitate the webinar. So we've completed 3 in April, and we look forward to our last one next Wednesday. So if you're at all interested, check out our websites. It's also on the SARM website about registering. Really, it's great information, awareness, and tips about self-care. And I think we all need a little bit of encouragement and hope in some of those areas during this pandemic. I'd now like to talk a little bit about the virtual Discovery Days for 2021. The Discovery Days, the pandemic has changed how we're able to deliver these. Instead of a presenter, usually Shelley and her team that we trained would be going out to the rural communities and delivering this in grades 4 to 6. She's adjusted and meeting the classroom now via WebEx or Teams or Zoom, and she's delivering the virtual presentations. She's been doing it for a few months from her home, and I thank Shelley for all of her extra effort to make that happen. And now she's got permission to do some in the CCHSA, which has been great. So she's reached 13 schools, and this I think is phenomenal. And we love to be out in the community, and we can't, but so we're looking at various other ways, and this is just a great example. You'll see on this map, we were able to get some good reach throughout the province, and our funding with Sask Wheat and Sask Canola, that part of the program is over, but we're hoping to do a new proposal with them for continued support, and we'll be looking at other funders as this program grows. And thank you for the RMs in terms of promoting this as an opportunity for your rural schools as part of your membership. And we've reached over 5,000 students so far with this program. And not only do the students receive the information from hazard identification to grain safety, helmet safety, animal safety, they have a great activity booklet that they can take home with them, and safety package to talk about with their family. There's also an evaluation component, understanding their knowledge in these areas prior to the presentation and after. And Shelley's explained that she's had great feedback from that. And that just helps us to improve the program, see areas that we can do a little bit differently, and other topics to address. So moving forward in 2021, we're looking at expanding some of the presentations in the areas of mental health, ATV safety, and chemical look-alike displays. And again, if your RM is interested in a discovery days, please just let us know, and we will do our best to facilitate that delivery virtually or hopefully in person soon. The one-to-one health clinics, they're on hold. This is truly my passion in terms of the opportunity that I have to meet with the farmers one-on-one in the RM communities, usually in their RM offices. They're focused either on respiratory health or hearing health, and during that half-an-hour visit, I get an opportunity to learn about the farmers' exposures, their health. We do an assessment, and then talk about how to overall make improvements and resources that are available to improve their health and safety and their workers. So I've really missed this past year and look forward to the opportunity of when I can get back out doing these clinics. If your RM is interested, please send me an email, and when we can get back out in the fall, I'll definitely schedule that. Also, part of these clinics, I've received some emails and appreciate your patience in regards to the RM hearing clinics for RM employees. That program has been on hold also, and hoping in the fall that can resume again. And that I know some RMs have sent emails because of the recommendation of every 2 to 3 years to have that testing. That's hopefully we can get back at that very soon. And just let me know if you're interested or want more information about the clinics. And none of the testing has happened in the CCHSA. So our spring network and fall newsletters, these were the 2 that were delivered this year, and they were a little bit longer as we wanted to try and get a lot of information out to our farmers in 2020 because we weren't able to do the in-person contacts as much. So I'm just going to highlight a little bit. In the spring edition, it was titled Taking Care of the Farmer. And we focused on articles on mental health, COVID-19, just getting some information out there because not everyone had access to internet. Building resiliency, nutrition, the importance of sleep, symptoms of mental illness, tips for practicing self-care. And our goal of the topics was just to really help the farmer to look at their overall well-being and draw on their strengths and take action. These newsletters are also available on our website. And within the Spring Network News went our annual package of the electrical resource. So that went out to the 25,000 farm families, and SAS Power is also distributing this electrical resource when they're on the farm making calls to their rural customers. And those are available online too. Our fall network news, as the pandemic continued to impact our lives, we wanted to provide as much resources in KT related to the pandemic and addressing a variety of topics from someone struggling with mental health, the highlighting Bridges Health Avail app as a resource. A little bit of Q&A about face coverings and respirator use on the farm and some of the confusions there, and clarifying never has PPE been such everybody knows what PPE is now, and N95s. A little bit of highlighting the research with exoskeletons. We added some children activities as a lot of kids were at home and not in the school settings at that time. Highlighted dementia care and our Agrisafe program. This is our COVID-19 resource page that's on our website, and I'd like to thank Swaley for helping to keep this up to date. And we really felt that we needed a hub of information, credible information. There was so much coming out as it related to farm families and the impacts of COVID-19, and we classified that in those key tabs there. So check this out. The information is always changing, and we tried to have credible, up-to-date information there. As part of this, early in the pandemic, CASA, the Canadian Agriculture Safety Association, put a call out for leaders in egg health and safety across Canada to meet regularly to discuss COVID-19 and the impact and the resources and things that we could offer for our farm families. So I was involved in that from, I guess, end of March, and we're still meeting. And it was just a great opportunity for us to network and share resources across Canada, so we weren't all creating the same sorts of things, building on it. So a lot of that information is housed in here and also on the CASA's website. From that, this group, we continue to meet, and I think it's been great for the network. Well, it has, and in terms of knowing other resources that are available and building on those and webinars and such. So looking forward to getting a lot more of that information out to our Saskatchewan farmers. And for example, our daily chore, our stress resource, Nova Scotia and Manitoba and Ontario took that on and made some adjustments and got that out quickly to their farm families. So it's really about sharing some of our resources. So I just wanted to highlight that's on our website. Our reach and visibility, as I've said, you know, it's been very different this year. We continued with our radio ads and would like to thank SARM for coming on board with that. We were able to increase our capacity for length of times and budget. So we did a fall radio safety message campaign, and we hope to continue that this year. We did several interviews, radio, print material, and independent magazine articles. We had a present in some virtual trade shows, Egg in Motion and the SARM convention. Look forward to when we can be there in person. And also some of our staff participated in various conferences virtually to network and share our resources and learn about other KT that we can use here in our province. And also active with Agriculture Safety Week through CASA and numerous posts on Facebook, Instagram, and Twitter. This is our physical backdrop for our trade show that I guess we last set up last March, and I'm looking forward to when we can set it up again in person. Now I'd like to ask that Brooke talk a little bit about the Agrisafe applied KT component of the network.
Thanks, Kendra. So in 2019, the Canadian Agri-Safety Applied Science Program received $2.8 million over 5 years for 6 applied research projects, with each project incorporating a KT component. The projects focus on utilizing applied engineering controls to improve health and safety in Canadian agriculture. CCHSA and the network play an important role in developing, producing, and disseminating the results and outputs of the Agri-Safety program, and we often feature articles about the projects in the network newsletter, as well as share updates on our social media channels. So as part of the knowledge transfer project work plan, the team at CCHSA develops several outputs each year. Last year, in 2020, the annual program report provided a summary and update on the program as a whole, and updates on each project, including 6 informational bulletins that provided a background and introduction to each project. To complement these bulletins, we also developed an electronic newsletter that we are continuing to develop in the coming years of the Agri-Safety program. With the help of the U of S media team, we produced short introductory videos for each project to help provide a quick and easy way for the projects to promote and increase awareness of the activities of this work. And all these outputs for reports, bulletins, newsletters, and videos are available online at agrivita.ca. So I'll give it back to Niels now.
Thanks, Brooke. All right. So for this upcoming year, we have a few things that we'd like to continue and some things we'd like to start. Of course, as Kendra pointed out nicely, one program that's just really, I think, ballooned beyond our expectations from inception is this Discovery Days that has switched to virtual, of course, for now, but will be resuming in person eventually. And so we're going to continue to deliver that, look for other sources of funding for that. We have trained trainers for that in the past that helped us reach more schools at the same time across the province, six I think, presenters we had. So we've scaled that back a little bit in terms of volume just because of the virtual nature of it. And Shelley has been doing an amazing job carrying that forward. So that we want to continue to deliver and grow. Hopeful resumption, of course. They will resume, hopefully in person to some degree, sooner than later in 2021. We'll just have to see how things go of our workshops, webinars, and clinics that Kendra already highlighted. Of course, our newsletter distribution and social media presence will continue. The respiratory resource, you should be seeing that shortly in your mailboxes that Kendra also covered, that will be highlighted. We are due for strategic planning. We have been for about a year now. We met, I think, almost all of our targets for our previous 5-year strategic plan, which we were quite proud of. And we just found that whole process extremely helpful, and really revisited that frequently, and kept us on track for a lot of things, and also gave us a chance to explore new opportunities as they arose. So we're actually quite excited about doing that, and we'll certainly be looking to our membership for help there. So stay tuned for some communication on that. We also have a submission to CAP for the development and piloting of a Saskatchewan farm safety plan. There's a lot of interest in that now, I think, and across the country, really, a lot of interest in developing farm safety plans that can help organize and kind of put together a lot of the information that we've been sharing over the years, and really help producers reduce risks, reduce health and safety risks in their operations. So we're hoping that that will start this year. And another big thing that we always try to focus on, but have had difficulty doing so because of our, if we're focused in one direction, then the other direction sometimes doesn't get as much attention, and that's been recruitment. So we'd like to spend more effort recruiting RMs and having our membership grow to the numbers it has been in the last 5 years, but also beyond that substantially. So that's the work plan. And what we'll do now is I'll go through the financial statements, and when I'm just going to highlight a pointer here. And how do I move it, Adam? Oh, there we go. So we present these every year, and I think, like for most of us, this last year has gone a bit sideways in some respects from what was originally planned, and it certainly looks a bit differently financially than what we expected it might. So what I'll do is just kind of cover the highlights, I think, and talk a little bit about our budget, and then ask for just a motion to accept that report. So we have our actuals for this year are similar to what they have been in previous years. We get our funding from the Ministry of Agriculture, and thank you again to the Ministry for that. The Center supports and kind of helps cover gaps, or certainly provides support in a number of areas for the network, because it is an integral part of the network. So that's a regular source of revenue. The RM fees, of course, are a crucial part of our revenue. And then grants that we get from various organizations that Kendra outlined, including the Canadian Ag Safety Association, Agrivita, and others, the cap funding, etc. So the revenues for our actuals this year were less than we had budgeted, and to some degree, the matching that we were able to use and get through our Agrivita program was less than was budgeted, but we were still able to complete all of the activities that were planned despite that. And I think probably that the degree to which that will continue, I think, is probably pretty accurate, because we are able to complete all of our planned activities on with that expenditure the way it's listed there. So the other one thing that was different this year, of course, was, and this wasn't really something the network applied for, but the university, through a number of departments, was able to apply for some funding in the form of support because of the pandemic from the government. So that was done on our behalf, and it was done on behalf of a number of departments elsewhere, and represented some revenue that we normally don't get. And then our expenditures also looked a little bit different over this last year. And I think the one thing I want to point out is if you look overall at the down here at the subtotal for budgeted expenditures and actual expenditures, there's obviously a pretty big difference between what we thought we would be doing at the start of the year and what ended up happening as a result of so many things shutting down in the pandemic. So we had fewer expenditures for most things. And travel and website, and we went over this again because it's unusual to see zeros, but there wasn't any. So that was a huge change in expected expenditure. And our website, the expenditure in terms of other contracts or other bodies helping us with website material was not needed. We were there was reduced activity overall, but we were able to do the updates, including the COVID resource page that Kendra highlighted, putting the electrical resource online, all of that through our support in-house. So there was no additional expenditure for that. So that resulted in considerable less expenditure compared to what was expected. For our upcoming budget, it's pretty similar to previous years. The one,
Hi, Niels. Sorry to interrupt you. Just 1 second. I have to replace this chart for 1 second. Just 1 second.
Okay, yeah, I was wondering about that. I was going to speak to that, Adam, regardless, so that's okay.
You might have to just skip through a few slides, but the new one is on this presentation.
Sure. Oh, yeah. Thanks for that, Adam. So, right. So for the 2021 budget, we have similar sources of revenue accounted for, including our matched funds through the Agrivita program. And on our expenditure side, the one slight change that, if any of you caught it, that was different between what we had up there before and what Adam just updated was we have a smaller budgeted expenditure for the website updates, resulting in usually we're running sort of between a few $100s to $2,000 or $3,000 in revenues over expenditures, but usually pretty close to neutral, and hopefully back to a slightly normal pacing and a more balanced in and out for the upcoming budget year. Oh, and I lost my pointer. Sorry about that. I might just pause there for questions or for request a mover and a seconder to accept the financial report. Thank you, Sandra, RM 76. We may have a seconder coming. Thank you, Darren, RM 309. I do want to say a huge thank you to our staff. We say this every year. I think we all share the thank yous across our staff, but it has been a pretty remarkable year. I know we're all in that same situation, but on campus and certainly for the center, things changed quite dramatically over the span of a few months. And the way the team has pivoted and basically continue to offer and deliver in as best a way possible the services and the programs that we do, taking into account that we can't do this face to face, which really is our bread and butter. I mean, it is, as Kendra said, the Saskatchewan way to adapt, but also to really make those personal connections and make those one-to-one connections. And we miss that. We miss doing these things in person. We miss being out in the province and traveling and reaching the communities. And yet we've been able to adapt and pivot and make it work. So it's with a lot of pride and a lot of heartfelt thanks that I really want to congratulate the team for continuing to move our program forward. So now I see them patiently waiting in the ranks, I think, if I'm reading my attendance list quickly. It's my pleasure to switch to one of our awards. And usually I hide the screen a little bit and pop it up as a surprise, but that's okay. Tyler and Rochelle, we see you now, but I'm going to give a bit of background as to the scholarship history for the center, and then congratulate you both. So I'm pleased to be able to offer these scholarship awards again this year. We do so every year. And for those of you that might not be aware, back in 1995, I think it was, the Saskatchewan Association of Rural Municipalities, SARM, auctioned off the first copy of its history book, which was called The Building of a Province, commemorating the 90th anniversary of SARM. And that auction back in 95 netted a sum of $2,600, which SARM then, the board of directors of SARM contributed to CCHS. It was then called the Center for Ag Medicine, but CCHSA. And those funds were used to start what's called the SARM 90th Anniversary Student Scholarship in Agricultural Safety and Rural Health. And now that program continues, and that's what we're awarding today. And it is managed by the Founding Chairs Program at CCHSA. So this year, we're pleased to award 2 scholarships of $1,500 each to grade 12 students Rochelle Wright from RM of Vanscoy 345, and Tyler Moore from the RM of St. Andrews number 287. And they submitted essays about either the importance of health and safety on their farms or safety and health hazards on the farm. And unfortunately, we don't have a stage that you can come up on and hands to shake and pictures to take, but that's okay. Congratulations, Tyler and Rochelle, and thanks for joining us today. So virtual applause. Congratulations. And the other part of our afternoon that we're also pleased to be able to do, and again, unfortunately, we can't do this in person, is to recognize the support that you, our membership, has provided the Ag Health and Safety Network over the years. And of course, we do this by providing recognition and plaques for members that have reached various milestones. So first of all, I'm just going to go through these for each of the different year categories and read them out. And again, I'm sorry we can't present these in person. And those of you that are here, thank you for joining. But we will have those plaques and those awards sent to you. And again, it's just, we can't do any of this without your membership and without your support. And thank you for supporting the mission and vision of the network. So our newest members, and in recognition of their support for the last year, I'd like to thank the RM of Wise Creek and Orkney 77 and 244 for their 1 year membership. And you get a picture of your plaque on the screen because there's only 2 of you. When we get to the bigger numbers, we can't show everyone's. And a 5-year award. Congratulations to the RM of St. Andrews, number 287. Thank you for that. And for 15 years, thank you to these RMs, Coalfields number 4, Wiska Creek number 106, Bratz Lake 129, Crake 222, Big Arm 251, and Lipton 217. Thank you for your support. For 20 years, thank you to Waverly 44, Broken Shell number 68, Cupar 218, Lorburn 254, Elfrost 307, Winslow 319, Oakdale 320, Viscount 341, Progress 351, Hudson Bay 394, Douglas 436, and Prince Albert 461. 20 years. That's, you joined when I joined the center. Thank you for your support. And 25 years. Thank you to Eyebrow number 193, McKillop 220, Buchanan 304, Dundurn 314, Prairie Dale 321, Wolverine 340, Corman Park 344, Harts Hill 352, and Grant number 372. That's a remarkable milestone. Thank you for that quarter-century support. So that is greatly appreciated. And certainly, last but not least, our 30-year group, the senior bunch. Argyle number 1, Martin number 122, Pence number 160, Canna 214, Gary 245, Sliding Hills 273, Reford, sorry if I got that wrong, Rosedale, number 280, Rosedale 283, Big Quill 308, Leroy 339, Grandview 349, Bain 371, Rosemount 378, Lake Lenore 399, and Redberry number 435. Thank you so much. That's amazing. And again, it's a bit awkward that we're doing it this way. It's just the way things are these days. We'd much rather be handing those out in person. And that's it for our presentation today and our report. Thank you again for your support. And we look forward to working with everyone and hopefully growing our membership in this next year and in the future. So I'll stop there. I see Kendra's back. Thanks everyone for joining. And thank you, Mark, for sharing. Was there anything else on the agenda? Now that I say that, I better double check.
No, that's great, Niels. Oh.
I think if there's any questions or anything else, we have some time, but otherwise, I guess that probably concludes our AGM. So thank you for joining, everyone.
I think Mark was just going to close there, but we weren't able to hear you, Mark.
Right.
Can
Sorry,
you hear
Mark.
me now?
Yes, perfect.
All I have left on the agenda is new business. Network Steering Committee update and network strategic planning process. That was pretty much covered in your presentation though. Okay, other
Kendra,
than
do you want to
that,
just touch? Sorry, Mark. Kendra, do
no,
you
go
want to just
ahead.
briefly touch on the process for filling gaps in the steering committee?
Yes, the we've been in contact with SARM, and the district meetings some have taken place, and I think there's some still going to be taking place. And our connection with Laurel and getting the meeting minutes from those division meetings, and then from that there will probably be the new volunteers for the vacant divisions. So that'll probably all happen within the next few weeks, that we'll have our new board, our new steering committee.
Thank you for that.
And unfortunately, there will be some virtual meetings, but then we can meet in person.
Sounds good. If there's no further questions, I'll give you a few minutes if there's a couple questions. And if there's no further questions, we will look at adjournment.
I'd just like to thank, oh, sorry, Mark. I just wanted to thank SARM for this platform and facilitation, Adam, and getting us as presenters all set up earlier this week. And this was all new for us, but really appreciate it. Just we couldn't be at the SARM virtual, like I know everything was cut back with the virtual conference, but SARM worked with us to offer this opportunity, and we're just very grateful that we could offer our AGM on the SARM platform. And thanks, Adam, for all your technical support.
I'd just like to take a minute and thank everybody for attending, and to you all for the presentation. It was very good. Thank you very much.
Thanks. Bye-bye.
I don't see any. Go ahead.
Oh, carry on.
I don't see any questions popping up there, so if somebody'd like to adjourn it, I'd like to call it a day then.
Yes, and hopefully next AGM we'll have breakfast together.
That sounds good. Looks like Regan McDonald moved, so we are adjourned. Thank you, everybody, for attending.
Thank you.
Have a good day,
Bye.
everyone.